saw her right there, and Dr. Mimi Lee is here with Vein and Aesthetic Care in Little Rock and her patient, Margaret Faulkner, to tell us more about varicose vein closure. And it's good to have both of you. Welcome, especially to hear from someone who's had the procedure done. But Dr. Mimi, let's start with you and talk a little bit about this. And you were really one of the first in Arkansas to do this type of procedure.
Yes, thank you for having us here today. And yes, I'm the first physician in Arkansas to do this closure procedure, which is a very gentle treatment for varicose veins.
When Margaret came to you, what was her condition?
Well, Margaret had, throbbing pain and some, cramping at the bulging vein area, and she was also uncomfortable with the way they look. And so we did an exam and an ultrasound and found that she has circulation problem that's leaking down the blood flow into her lower leg. And so I recommended the closure procedure, which corrects her blood flow.
Okay, Margaret, what was that like going through the procedure?
It was very, very easy. It was remarkably, no pain.
Right.
Very quick. The results have been incredible. I'm very pleased with the way my legs look, the way my legs feel.
Yeah.
So,
and you said your husband says?
Yes, he says my legs look good.
Yes, very good. Let's put up some before and after pictures because I think that can really kind of explain. And what made you want to go and investigate the procedure?
Well, actually, I had another doctor who had mentioned going to see Dr. Lee. And she said that Dr. Lee could help me. And so on a whim, I went to see her and was just amazed at how nice she is, how nice her staff is, and how easy the procedure was. It was very quick and very little pain, very little sedation. And I love the way my legs feel. I love the way my legs look. It was all, everything worked out great.
Wonderful. Dr. Lee, we were just looking at some pictures. Was her condition and her results pretty typical of what we see?
Yes, the treatment is really quick and easy, and the diagnostic part of it using the ultrasound is also very important, and so that we make sure it's a blood flow issue and it's corrected and it's covered by insurance.
Oh, that's very good. What are some of the signs people should look for? What does this feel like?
Well, typical symptoms of venous disease will include leg pain and heaviness and tiredness, swelling and cramping. And because it's a blood flow issue, it will get worse if you don't correct it. And it can lead to skin changes, inflammation, discoloration, ulcers, and even blood clot. So it's really a health condition that's easily treated today, and once again, it's covered by insurance.
Yeah, some people may say, I don't know if I have the varicose veins or if I just have spider veins. They should come get it checked out either way.
Absolutely, yes. Yeah. And we're here to guide them and help them.
Right. Okay, let's talk about recovery. How long did it take you to just get back to normal?
The next day. I mean, there was really nothing to it. In fact, the day that I had the procedure, she said that I needed to lay around that day, which I didn't mind doing that at all.
We wouldn't mind that.
No, but I mean, there was no downtime. I was up and going, and I usually have a hard time in the summertime wearing dresses and shorts, and I can't wait this summer.
Ready.
I am ready
for
to wear my shorts and my dresses.
Wonderful. You've got some free screening dates coming up?
Yeah, we're hosting our free vein screening next week on the 10th and the 11th. And so we want anybody who has some questions or whether they have a vein problem to give us a call.
Okay.
We'd like to help.
They need to call ahead and make an appointment for that. Okay, so it is a free vein screening coming up on March 10th and 11th, so you've got a little bit over a week to plan for that. But do give them a call at 501-224-0880 if you think you may need this procedure, and you can always check them out, drvmili.com. Margaret, thank you so much.
Thank you.
We're so excited that you're happy about your results.
Yes, thank you.